Hello, everybody. Welcome to the Prego Expo. Thank you so much for joining me today. My name is Lindsay, and I am a representative with Americord Registry, which is a company that does cord blood banking. So I'm going to talk to you guys a little bit today about cord blood banking, a little bit about Americord, just to give you guys some information about what we do. I'm going to share my screen and go into some of the presentation information just so you guys can see a little bit of the program. So Americord is a company that does not only cord blood banking, but as also they do placenta banking and cord tissue banking as well. So a little bit about the industry. Cord blood banking really started in the mid 90s and has grown tremendously in the past 30 years. So Americord started in 2008 with cord blood. Cord tissue came a couple years later with 2011. And then actually last year was the first time we introduced placenta tissue banking to consumers. So it's a really new concept for us. A lot of regulatory information if you guys follow that about labs. But to get into a little bit of information about cord blood banking, if you've never heard about it before, or maybe your research has kind of just started, cord blood banking is essentially when the baby's born, you can extract the blood from the cord for the cells to keep for the lifetime of your baby, and they can benefit yourself, your baby as well. So starting in the early mid 90s, a lot of it was experimental, but at this day, there are over 80 diseases and conditions that are treated with cord blood cells. So any blood diseases like leukemias, lymphomas, lupus, and anemias. And then there are also tissue cells that are available to you as well. So once you extract the cord blood from the cord, there is the remaining tissue cells. So those cells can actually treat a lot of different other concerns. So tissue stem cells can turn into skin, bone, cartilage, fat cells, organs, tissues, muscles, so many other things really that aren't blood. So the treatment options, there are currently over 50 clinical trials right now for diabetes, Alzheimer's, spinal cord issues. The list goes on for the different treatments that are available for cord tissue. A lot of questions that we get from people as we're talking about cord blood. You'll hear a lot of probably friends and family members and even doctors talking about banking cord blood. They may make a recommendation, private versus public or public versus private. So we get a lot of questions about what is public banking. If I decided to donate my stem cells, what happens at that point? So to give you the comparison, public banking is essentially the donation to where your cells are then made for public use for public consumption. So only about 30% of the stem cells that are banked publicly are actually kept. So if there are any concerns with mom, if she's ill, if she has a certain number of diseases, they cannot use her stem cells for a public bank because essentially those are accessible by anyone. So a big concern is that they won't actually be used for research or for yourself or your baby. The other concerns with public banking are that they are not necessarily available to you. So once they become available, parents no longer have exclusive rights over those cells, so anybody could use them. In addition, it is very costly. If you ever needed your cells, they are available. It can cost anywhere between $30,000 and $50,000 to actually take those out versus private banking, small upfront cost to private banking. Those cells can be stored for an unlimited number of years. Most people will actually start with 20 years storage, but you can do up to lifetime, which is 75 years. So those are yours. You have exclusive rights. They become available to baby once they are of a certain age, and can be used later on in life as well if they don't have any concerns as they're younger. Here are a couple of the diseases that can be treated with stem cells. So cerebral palsy, autism is a big one. There are a lot of studies going on right now for autism. Rheumatoid arthritis, not necessarily needed for children, but as they grow into adulthood, rheumatoid arthritis is a big concern that a lot of people deal with. Multiple sclerosis, heart disease, stroke. Little bit about Americord. We are one of very, very few companies across the US that does placenta tissue banking. So cord blood and cord tissue have grown in popularity in the past several years. A lot of people are actually doing those storages for cord blood, cord tissue, just because they see the benefit for the baby as not only as their infants, but also as they get older. And then cord tissue, placenta tissue are a little bit newer. So, and different type of cells available for each type of stem cell storage. Cord blood, they're called hematopoietic stem cells. Those are the ones that can really turn into any blood cell, red blood cell, white blood cell, or platelet. Cord tissue, those are called mesenchymal stem cells. So those are the ones that can turn into really anything else, all the other types of tissues. And then the placenta tissue actually is comprised of both the MSCs, the mesenchymal stem cells, as well as another kind of cell called an amniotic epithelial cell. So those have a lot of potential uses for superficial treatments, burns, cuts, scrapes. There are some theories that after mom has the baby, if she has a C-section, that those can be used for her scarring as well to help the healing process. So a lot of really cool uses for stem cells. And everything Americord does is stored in a 5-chamber bag. So your cord blood is stored in 5 chambers, cord tissue and placenta tissue. There are 5 samples of each that are stored so that you can use them up to 5 opportunities for transplants. And the amount used per transplant really depends on a child's age, weight, size, that kind of stuff, and how much blood is needed or how many cells are needed. And then we have very high quality anticoagulants that go in the bag when the blood is stored, as well as really high quality ingredients that are used for transport and even for storage. Once they're stored in the lab, which is in Allendale, New Jersey, those cells will actually be stored in one of the highest quality available on the market, storage cryopreservant. So they'll be nourished as long as you need them. If it's over the course of a lifetime, they'll still be quality guarantee. And that actually brings me to my next point about our quality guarantee. So we have the highest quality guarantee in the industry. Essentially, at any point throughout your child's life, if you ever needed your cells, for whatever reason, if they did not engraft, there would be essentially $110,000 that we would put towards the alternate treatment should you need it. So it's never happened, but should you need that, it is there for you, just to give you that extra sense of security that your cells will work or that you'll have treatment for your child in the future. We have great pricing options. That's one of the really big benefits to you guys being here for the expo today. I'm going to make sure you have all the contact information. Once the presentation's over in the booth, I'll actually have all of the contact info for Americord available to you. Should you call into the company to inquire about stem cells a little bit further, find out what the pricing options are available to you, if you mention the Prego Expo, you will be eligible for some of the best pricing that we have. And also, based on the time of year, it's around Black Friday time. So there are some fantastic offers for that as well. And then you don't necessarily have to pay any yearly storage fees if you do upfront pricing, which is really nice. You just do it all at once and then you're done for 20 years. And then going into, again, a lot of the diseases that are treated, that's what a lot of people ask about is, well, what can I use them for? How can I use them in the future? And these are all the things that are currently in clinical trial. But in the past 30 years, we've gained 80 different approvals by the FDA for cord blood. So cord tissue we're just at the beginning of that technology as well. That's kind of what the 5-chamber storage bag looks like for the blood. And then there's what the tissue would look like, essentially. The amnion is used and then split into sheets that can be used for superficial uses. And I'm going to here's some of the common questions that we have. So a lot of people ask, what does it look like when the cord blood is actually extracted? Is that harmful for a baby? Does it hurt? What does it look like? So once you have the baby and the cord is clamped, they will just extract the blood at that point. So you don't feel it, baby doesn't feel it. It really has absolutely no impact whatsoever on you or the baby. And then we talked about a lot of what makes Americord unique, the highest quality ingredients, the highest level of a quality guarantee. And then also, of course, we offer 3 different types of stem cell banking. Those are 3 of the biggest differences for us as well. And then we get a lot of questions about the lab. For those of you who have done some research on cord blood, you may ask, where's your lab located? What happens if there's a power outage or if there's a weather issue? One of the huge benefits to Americord is that our lab is located in Allendale, New Jersey. So the benefit to that is it is a geographical safe zone. So there isn't too many things that happen in Allendale, New Jersey from a weather standpoint, which may give you a little bit more security and comfort knowing that there probably aren't too many issues with weather-related concerns. However, there are tons of things in place for flooding, for hurricane, for power loss. There are generators. Everything is kept on concrete blocks. Generators can be refueled even after a week. So you essentially have the benefit of no power outage for at least 2 weeks. And if there were more than 2 weeks of a power outage, there'd probably be a bigger issue. So we talked about the cord blood stem cells. Some people say, what if I needed them 50 years from now, 75 years from now? Obviously, a lot can change in 75 years. So we're assuming that based on the trajectory of cord blood stem cells over the past 30 years, the same will be true for the tissue in the placenta as well. There'll be far more uses available in the future than there are now. And there's no evidence that says that those disintegrate in quality over time. So they can legitimately be kept for your child's lifetime. And as far as banking your child's cord blood, we have a lot of systems in place so that if you did make the decision at the very last minute, we can support you. It's best, of course, to make the decision about a month in advance or so before you have the baby, because as you're planning and you're getting everything ready, your overnight bag, you would actually take your kit with you. So part of the process, which is the next question, once you decide to bank with Americord, we actually do the enrollment process, which you get all your paperwork. They send you a kit that you'll have at your house ready to go in the event that you go into labor. You take it to the hospital with you, and then everybody in the hospital knows once you have that kit there that you want to store your cord blood. And then you obviously, it's specified on the packaging if you want cord blood and cord tissue, cord blood, cord tissue, placenta, whatever it is that you're interested in. So really all you have to do at that point, bring the kid to the hospital. And then someone, probably usually it's dad, is usually in charge. Once the delivery is done and you've collected their stem cells, you would just call the courier, which the number is actually on the kit, to come pick it up. And then it's transported to the Allendale, New Jersey lab, which that process usually takes about 24 hours. And the blood anticoagulant that's in the packaging is good for 72 hours. So that gives you a little bit of leeway, because we know the first thing you want to do when your baby's born is not call a courier to come pick up your kit. So we do recognize you want some time with baby first and some time as a family before you have to think about anything else. And then cord blood, it's not as expensive as most people think. Most people can start the process as little as $1,000. And then it varies by how many products you're storing and for how long. So those discounts, there are discounts associated with how many stem cells you're storing, what kind, and all those good stuff. So I'm going to actually stop sharing my screen just in case you guys have had some questions. So are there any questions? Is it considered to preserve the placenta? I'm curious what you mean by that one. If you could elaborate on that one a little bit. But I'm going back up. I'm going to actually scroll all the way up to the questions because it looks like I've missed quite a few. So it's amazing. Good info. You could preserve other parts. I had no idea you could use cord blood. If the placenta has to be examined by pathology, can it still be banked? You don't pay up front. That's a great question, actually. You don't pay up front for the whole storage. You actually don't pay storage until once the lab receives all of your stem cells, and those are processed, which usually takes about 5 days. Then you get the bill for whatever the remaining of the invoice is. And you have options even to take care of the invoice. You can pay over time. It's not something that has to be done right away. And if they weren't able to accept your placenta, obviously you would not have to pay for that. It would essentially just be at that point cord blood and cord tissue if that's what you decided to do. And then if the placenta had to be examined by pathology, they would probably take the whole thing, usually. So in that case, it would not be able to be banked. But if you can talk to the hospital technicians, you can talk to the nurses, if they're able to save the amnion, that's the most important thing that we use for storage. So if they were able to save it, you could absolutely do both, send your placenta to pathology as well as keep the amniotic layer of the placenta itself. Another great question by Kate, can it only be used for that child, or can you save it for other family members? You can actually use it for other family members. So for the blood specifically, there are what are called tests that are needed to be done for essentially a match. So if there's HLA matching that's involved with cord blood, that will determine if it's good for mom, dad, other siblings. Usually if you have 2 children by the same parents, there's a pretty good likelihood, around 50 to 75%, that it will work for both children. For mom, the percentage gets a little bit less and less. So depending on the distance of the family member, those chances of the HLA matching being successful is a little less. However, for cord tissue and placenta tissue, HLA matching is not required. So since we're talking about tissue cells at that point, those cells can be used for other members of the family. So if you have a degenerative condition, or if there's something with a joint or a muscle or a bone that needs to be corrected in the future, or even now, or cerebral palsy, rheumatoid arthritis, all those other same concerns, those cells can potentially be used for other family members as well. So, and once we're done here, we can even go into the booth and get into a little bit more granular detail about those kinds of things as well. If you guys have specific questions about concerns, family history, those kinds of things. And I think I'm going to scroll down a little bit. How do people decide which parts to bank? It's another really good question. So since you have three options, cord blood, cord tissue, and placenta tissue, almost everyone at this point, if they're banking cord blood. So that's kind of the standard at this point if you're considering, because it has the most FDA approvals, it's been around the longest, and most people have at this point had some kind of need for it. But if you think about the benefits, cord blood versus cord tissue, there are actually a lot of potential uses for cord tissue outside of just your blood issues, blood concerns, cancers, leukemias, lymphomas, those kinds of things. There's so many other treatments with tissue that a lot of people will go ahead and do cord blood and cord tissue. And about, I would say, 1 out of every 3 people decides to bank their placenta as well. So it's just an extra source of stem cells should you need them. But that's completely up to you. And the pricing structure right now for placenta banking, it's almost like you're getting it for free because they discount each product. Every time you add a new product, you get a discount. So kind of like phone, internet, and cable. It's almost like you get your phone for free. At least that's how it used to be. I don't know who has a home phone anymore, but it's kind of similar pricing when it comes to placenta banking. So once you make the decision and you want to find out exactly what it'll cost, we can go over all those details. But a lot of times, if the placenta banking is free, why not? And then somebody asked, can you leave them to someone after you pass away or choose to donate? Another really good question. So once your child actually turns 18, those cells as part of the paperwork can be automatically given to the child. Should everyone pass away, which is hopefully never the case and probably pretty unlikely, but should that happen, then they can be donated. I'm sure that there's a situation. I've never come across that. So, but if something were to happen to you, those stem cells would be available for your child once they become of age as well. And I'm so glad you guys are excited about this and you think it's a great option for your baby. I think at this point, I haven't answered all the questions that are in the chat, but I'm going to be available at my booth after this. So if you guys want to stop by and ask any specific questions, since again, I wasn't able to get to everything, I can kind of make a list of the questions that we have here if you want me to answer those right away in our booth. So looks like it is 11:20. So I am going to head over to the booth and see you guys over there. Thank you so much for joining me again today and for coming to the Prego Expo. If you guys are in the Tampa area and you're coming to the live show tomorrow, I really look forward to meeting you all in person. And again, thank you so much for stopping by. I'll see you in the booth.